I'm looking at the chart for Kam Kacey. Date of birth is January 29, 19XX. No allergies. And looking at the orders, it looks like there is a order to insert a NG tube and connect to low continuous suction. So I'm going to look at his results. And it looks like he has some obstruction, dilated bowel loops, consistent with small bowel obstructions, so that's going to be the reason for the NG tube. So I'm going to go ahead and collect my supplies and then we'll head into his room. So I'm going to have a towel. I have a serum sump NG tube, and this is going to be 12 French, which is appropriate. We have a serum sump. Looks like both are intact. Okay, then I have my stuff for oral hygiene. I have my lubricant, I have my tape, my adhesive, and my graduated cylinder. Okay, so we are going to head in. Okay. Knock, knock.
Hello?
Hi, my name is Heather. I'm going to be your student nurse today.
Hey, I have no female too.
And I'm going to do some hand hygiene. Okay, could you please verify your name and date of birth for me?
Kam Kacey, 01/29/1956.
Okay, perfect. And Kam, do you have any allergies that I need to be aware of?
I do not.
Okay, perfect. Provide privacy. Can move this out of the way. Okay, so I'm going to get the bed elevated. So Kam, it looks like your results came back showing a small bowel obstruction. So the doctor has ordered a placement of a NG tube. Have you had an NG tube placed before?
I have not.
No? Okay. So with an NG tube, we're just going to insert a plastic tube through your nose. It's going to go down your esophagus into your stomach. This is going to help with the decompression since you do have that obstruction. It can be discomforting if there is any pain or any difficulty or issues that you have. Let us know during the process and after the process. Do you have any difficulty swallowing today, or are you experiencing any shortness of breath?
No, not really.
Okay. And for your pain today, how would you rate your pain on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain?
Maybe a 4.
A 4? Okay. So I'm just going to do a couple of assessments and then we'll move forward to your insertion. So is it okay if I remove your gown to start with your abdomen?
Sure.
Okay, perfect. So I'm going to do hand hygiene again. Have the bed raised and just confirming it is locked. Okay, so I'm going to go ahead and just remove your blanket and lift up your gown. So looking at your abdomen, it looks like your skin is free of any lesions, lumps, bumps. The color is appropriate for your ethnicity. So I'm going to listen to all 4 quadrants. Okay, so I do hear some hypoactive sounds, which is expected with the obstruction. So I'm going to palpate. If you feel any discomfort or pain, please let me know.
Okay. That's a little tender.
Yeah, I'm sorry. Okay, perfect. All right, so I'll get you covered. And then next, I'm just going to do a quick respiratory assessment. So I'm going to assess your skin, assess your breathing, and then take a quick listen to your lung sounds.
Okay.
So I'm going to roll down your gown. Okay, looking at the skin, looks like your skin is appropriate. The color is appropriate for your ethnicity. There's no adhesions, lumps, bumps. There's no skin breakdown or irritation. And go ahead and just breathe normal. Okay, so equal rise and fall, symmetry there. So I'm just gonna go ahead and take a quick listen to your lungs. So go ahead and just breathe normally, and I'll keep moving my. Okay. Okay, lung sounds are clear. Let me go ahead and get you positioned forward so I can repeat the same process to your back. All right, so get you forward. Okay. Looking at your back, it looks like the skin again is clear. There is no lumps, bumps, bruising, swelling, adhesion, or lesions. Skin color is appropriate. So I'm going to go ahead and listen to your lung sounds in the back. Are you doing okay so far?
Yeah.
Okay, perfect. I'll actually put you back so I can put this on. Okay. Okay. Okay, perfect. So lung sounds are equal and bilateral and clear. So there's nothing concerning, and you should be okay to move forward with the insertion. My last assessment is going to be a quick inspection of your nares. So I'm going to have you look up. Okay, looks like both nostrils are moist and pink. I don't see any irritation or tissue breakdown or damage. I'm going to take a quick look in your mouth. Mouth is moist and pink, looks good. Okay, so we are good to move forward. All right, so I'm going to go ahead and get set up. All right, so I'm just going to drape this over you to protect you. Gonna get my teeth.
Was there any little ones that I missed? No. You did good. Good job, girl.
Perfect. And then I'm gonna find my little Sharpie. I don't think I have that. Let me check your drawer and see if there is a pen. Let's see. You know, I think it fell on the floor. I'm just gonna reach under and grab that really quick. There it is. Okay. Perfect. So I have all my supplies. So I'm gonna go ahead and do some hand hygiene and get some gloves. Okay, so the first thing I'm going to do is I'm going to measure the tubing. And so I'm going to remove my tubing. And take out my anti-reflux valve. Let's connect. Okay. All right, so I'm just gonna go ahead and measure So I'm gonna do nose tip to ear, and then ear to your xiphoid process, which goes about here. So it looks like we're gonna be at the 65. And let me do another measurement just to make sure that is accurate. Let's see. Right here feels about right. So we're at a 55. So I'm going to go ahead and mark that with my tape. And then I'll do a quick mark on that. I'm going to get this glued. Okay, so before I start, I'm going to have you use your right hand and hold up your hand if there's any part that is uncomfortable, you want me to stop, if you have any pain, if you feel like you need to throw up. I'm going to be assessing for any cyanotic. If you are gagging, then I'll stop as well. I'm also going to have you tilt your head back while I insert. Once I reach the back of your neck, I'm going to have you tilt your head, bring your chin to your chest, and then have you sip some water while I continue the insertion. Do you have any questions before I begin?
I don't think so.
Okay, perfect. So I'm going to have you tilt your head back, and then I'm going to start, and we are in. So I'm going to have you tilt your head forward, bring your chin to your chest, take some big sips of water while I continue. Okay, chin is forward, we're still advancing, you're doing great. Okay, and perfect, we are at our mark. So go ahead and relax. And then I'm just going to do a quick temporary tape. Are you doing okay so far?
Yeah.
Okay. And then I'm just going to go ahead and get this secured to your gown. So we're going to have X-ray come in and do a quick X-ray just to make sure that we are in the correct place. And before that, I'm going to aspirate some of your gastric fluid to also check that we are in the correct place. Okay, perfect. So we have secured. I'm gonna go ahead and change my gloves. And these gloves are getting smaller and smaller each time. Are you experiencing any discomfort, or do you feel like you need to throw up?
Not really, no.
Okay, perfect. All right, so I'm going to aspirate some of your gastric acid. Okay. Put that there. Came out a little faster than expected. Alright, let's do a quick pH strip test to see where we are at. Okay, let's do a quick dip. And then looking at our little cheat card, it looks like we're about a 5. About a 5, so we are within range. Perfect. Okay, so I'm gonna go ahead and return your contents. All right, I'm gonna give you back some of this gastric acid. Okay. Okay, so I'm going to go ahead and call up X-ray and then have them come take a quick look at you to complete placement. While they do that, I'm going to do a quick cleanup. And okay. Alright, so it looks like X-ray confirmed that we have the correct placement. So I'm going to go ahead and secure your tubing. Okay, so I'm going to go ahead and remove this. And then I'm going to go ahead and apply the secure tape. Okay. And then we're going to move ahead with connecting the suctioning. So this isn't going to affect anything. You're just going to hear kind of a loud buzzing behind you, but everything is fine. So I'm going to go ahead and come around to get the tubing. Okay, and then I'm going to get that turned on. Okay, make sure that is out of the way. And then looks like we are done with our procedure. Would you like any oral care today?
Sure.
Okay. I'll get some notes for that. Yeah, that's the buzzing you're going to be hearing in the background. It should calm down. I'm sure it's going to be something you'll adjust and tune out to. Okay. Let's open this first. Alright, so I'm going to have you take a sip of water, swish, and then spit. Okay, then I'm going to go in and do some oral care. Okay. Another sip of water, swish and spit. Okay, perfect. Alright, we should be all set. I'm going to go ahead and get you lowered. Okay. We can recline you just a little, but we want to keep you positioned upright. I'm going to take message 5. And this is that. All right, and then you have your table for your personal items. Do you need anything else?
I don't think so.
Nope, okay. Your call light is right here. So if you do need anything, just give us a buzz and we'll come in and help you with what you need.
Okay, thank you.
Okay, thank you.